You're getting dressed when your fingers brush against something that wasn't there before. A lump. Maybe it's soft and seems to move beneath your skin. Maybe it feels like a small, smooth ball. Or perhaps it's red, painful, and appeared almost overnight. From the outside, they can all look like simple bumps. But beneath the skin, completely different things may be happening. One could be made of fat. Another could be a tiny sac filled with keratin. Another may be the result of your immune system fighting an infection. Most lumps and bumps are harmless, but sometimes the way a lump grows, changes, or behaves can be a reason to get it checked. So what can a lump actually tell you? Let's begin with one of the most common, the soft, movable lump many people discover completely by accident. Lipoma. If a lump feels soft, almost doughy, and seems to slide slightly beneath your fingers, one possible explanation is a lipoma. A lipoma is a slow-growing lump made of fat cells. It usually forms in the layer of fatty tissue just beneath the skin, where the cells gradually collect into a soft, rounded mass. Because it sits beneath the skin rather than growing from the surface, the skin above it often looks completely normal. And unlike an inflamed bump, a typical lipoma is usually not painful. That combination, soft, slow-growing, and somewhat movable, can be reassuring. But it still can't tell you with certainty what a lump is. A new or unexplained lump may need to be examined, especially if it keeps growing or changing. But now imagine the lump feels different. Not soft and spread out, but more like a small, smooth ball beneath the skin. Inside that bump, you may find something completely different from fat. Epidermoid cyst. Instead of a collection of fat cells, this lump may be a cyst, a small sac that forms beneath the surface of the skin. One of the most common types is an epidermoid cyst. It develops when skin cells that would normally be shed from the surface become trapped deeper inside. Those cells continue producing keratin, the same tough protein found in your skin, hair, and nails, and over time, that material builds up inside the sac. That's why the bump may feel smooth and rounded, sometimes with a tiny dark opening visible at the center. You may have heard these called sebaceous cysts, but that name is often inaccurate. Most epidermoid cysts are filled with keratin, not the oily substance produced by sebaceous glands. Many remain small and cause no problems, but if one becomes inflamed or infected, the situation can change quickly. The bump may swell, become tender, and turn red. And when a lump becomes increasingly hot, painful, and swollen, you may no longer be looking at a simple cyst. You could be looking at a pocket of infection forming beneath the skin. Boil or skin abscess. When bacteria trigger an infection beneath the skin, your immune system immediately responds. White blood cells rush into the area to fight the invading microbes. As the battle continues, dead cells, bacteria, and inflammatory fluid can accumulate together, creating a pocket of pus beneath the surface. This is what happens in a skin abscess. A boil is a related type of infection that often begins around a hair follicle. Unlike a quiet lipoma or an uncomplicated cyst, an abscess often makes its presence obvious. The area may become swollen, warm, red, and increasingly painful as pressure builds inside. And while it may be tempting to squeeze or drain a painful bump yourself, doing so can sometimes worsen or spread the infection. Rapidly spreading redness, worsening swelling, fever, or feeling seriously unwell are reasons to seek medical attention promptly. But not every firm bump is painful or filled with infection. Some remain small, quiet, and almost unchanged for years, and the next one is a perfect example. Dermatofibroma. A small, firm bump that seems to stay in the same place for years could be something called a dermatofibroma. This is a common, usually harmless growth that develops within the deeper layers of the skin. It often appears as a small, firm, raised bump, frequently on the legs or arms, and its color can range from pink or brown to darker shades, depending on the person's skin tone. One interesting clue is what doctors call the dimple sign. When the skin around some dermatofibromas is gently pinched, the center may sink inward slightly because the growth is anchored within the skin. But that sign alone cannot confirm what a bump is. Any new or noticeably changing growth may still need professional evaluation. And while a dermatofibroma feels embedded within the skin, the next growth can look completely different, as though someone simply placed it on top of the surface. One of the most common examples is seborrheic keratosis. Despite its unusual name, it's a non-cancerous skin growth that becomes increasingly common as people get older. Instead of forming deep beneath the skin, it develops on the surface, which gives it a very different appearance from a lipoma or a cyst. It may look waxy, rough, or slightly raised, almost as if it has been gently stuck onto the skin. Some are light tan, while others are brown or nearly black. They can also vary in size, from tiny spots to larger patches. Because they can look so different from one person to another, seborrheic keratoses often surprise people when they first appear. Many mistake them for warts, moles, or even something more serious. And that's where appearance alone can become misleading. Some harmless skin growths can resemble concerning ones, while certain skin cancers may initially look quite subtle. That's why doctors consider more than just color or shape when evaluating a new skin lesion. So far, every bump we've looked at has either formed within the skin or just beneath it. But what if the lump isn't actually part of the skin at all? The next type of lump comes from one of the body's most important defense systems: swollen lymph node. That lump may actually be an enlarged lymph node. Unlike the bumps we've discussed so far, a lymph node isn't a skin growth at all. It's a small bean-shaped structure that's part of your immune system, helping filter germs and abnormal cells while supporting your body's defenses against infection. Most of the time, you don't notice your lymph nodes. But when your immune system becomes active, perhaps because of a sore throat, a dental infection, or even a common cold, they can temporarily become larger and easier to feel. People most often discover them in the neck, under the jaw, in the armpits, or in the groin. They may feel like small, rounded lumps beneath otherwise normal-looking skin. In many cases, swollen lymph nodes gradually return to their usual size as the underlying illness improves. But if a lymph node continues to enlarge, doesn't seem to have an obvious explanation, or is accompanied by other concerning symptoms, it's important to have it evaluated by a healthcare professional. By now, you've probably noticed something interesting. A lump can be made of fat, trapped skin cells, infection, a harmless skin growth, or even part of your immune system. And that's exactly why appearance alone can never tell the whole story. So, what about the lumps that don't fit any of these patterns, or the ones that keep changing over time? That's where doctors begin asking a very different set of questions. Not every lump fits neatly into a familiar category. Sometimes a lump doesn't feel like a typical lipoma. It doesn't look like a cyst. It isn't painful like an abscess. And it isn't obviously a common skin growth. Instead, it simply appears and slowly changes. This is where doctors become less focused on guessing what a lump is based on appearance alone, and more interested in understanding its behavior over time. Has it grown noticeably? Has its shape or texture changed? Has it become fixed in place instead of moving freely? Is it causing new symptoms? Those questions often provide more useful information than a single glance ever could. When a lump doesn't have an obvious explanation, or when it continues to change, a healthcare professional may recommend a closer evaluation. That usually begins with a physical examination. Depending on the location and characteristics of the lump, imaging, such as an ultrasound, may help reveal what lies beneath the surface. In some situations, a small tissue sample, called a biopsy, is the only reliable way to identify exactly what the lump is. Most importantly, needing further tests does not automatically mean something serious has been found. In many cases, these evaluations simply confirm that a lump is benign and provide peace of mind. So, if appearance alone can't reliably tell us which lumps are harmless and which deserve more attention, what clues should you actually watch for? Let's bring everything together with the warning signs doctors pay the closest attention to.